Compliance is a measure of distensibility of an elastic structure. In other words, compliance is essentially how much can we stretch a structure before it sort of damages or creates problem. And the way that we measure compliance is a measure of the change in volume over the change in pressure. So, in other words, a high compliance means large changes in volume do not lead to high changes in pressure. So if we look at the lungs, one of the things that we have to remember is here's our lungs, is that our lungs are surrounded by the pleura. And inside of here is that pleural fluid. And that pleural fluid is going to exert pressure in this direction. Now the lungs are going to exert pressure in this direction, right? So if we look at the pressure pushing in this direction and the pressure pushing in this direction, if we sort of add those two together, what we get is a net force in this direction. And that net force is known as the transmural pressure, right? That transmural pressure. And sort of what we are looking at when we look at compliance is how much can I expand this volume of the alveoli before I get large changes in this transmural pressure, right? So we want to see, can I expand the lungs without creating these large changes in the pressure, right? And that is what we call compliance. So a more compliant lung we can get larger changes in volume with small changes in pressure. If we have a non-compliant or a less compliant lung, that would be like a more rigid lung where when we push and increase this volume, we have great increases in those in the transpulmonary pressure, the transmural pressure, right? And so when we do this, right, this is a measure of the distensibility of this elastic structure. So when we push on it and we change the volume, it is going to want to recoil on us, right? And so the recoil of the lungs is sort of dictated by this transmural pressure. And we will talk about the recoil of the lungs in a future video where we talk about the compliance and surfactant.